My name is Asnik Tafara and I'm a health extension worker for Nashanfalin Kabali. After being trained by the Clinton Foundation, I'm involved in providing HIV counseling and testing service. I believe a big difference was observed in testing pregnant women because we took the training. As an example, we can take a pregnant woman living in Nashanfalin Kabali. Now for this woman, if we were not trained and just gave her the reference slip, she would have had to walk an hour and a half to the health center. And an hour and a half is for those who can walk fast. But for pregnant women, it might take much longer, and that's very hard to do. This was one of the reasons why pregnant women were not tested, but now they can get the service here at the health post at any time convenient for them, or we can conduct the test at their house.
በአጋጣሚ የተራኮማ መድኃኒት ሲሰጥ ነበር የተራኮማ መድኃኒት ሲሰጥ
Fortunately, medicine for trachoma was being given, and I was asked if I was going to take pills or not, and I refused. I asked for the liquor type, and they gave me that one, and told me that I need to go to health center and get tested for HIV.
እሺ ብሎ ያንን ይቀባሰብኝና ለወደፊቱ በሂደሽ HIV ምርመራ እንድታደርጊ
በገጠር አካባቢ ነፍሰ ጡር መሆናቸውን የሚያውቁት ወይም ሰው እንዲያውቅላቸው የሚፈልጉ
In the rural parts, pregnant women reveal themselves as pregnant when the pregnancy is 6 or 7 months old. Until then, they keep it a secret from everyone in their community. When tracking down pregnant women, we were missing these women because there was no way to find out their pregnancy. This may be due to the culture or the way they dress. It is hard to identify that they are pregnant. But at the time of the Zithromycin campaign, women were told that they should not take the vaccine if they have not had their period for 3 months because it can be harmful for the child. When this information was announced at the time of registration, pregnant women still at the early stage of pregnancy were forced to reveal themselves. We enrolled these women in FastTrack, and as a result, we were able to increase our coverage and provide PMTCT service for many pregnant women. So the Zithromycin campaign was a supporting campaign for FastTrack.
I was involved in many health-related interventions in the past. I am also a member in Kabali Cabinet, and I am employed at Kabali since 1984. I have been here for long, and I have never seen intervention as effective as FastTrack. This intervention is done by going door to door to convince pregnant women to get tested, and also make sure that no pregnant woman is left out. In the past, this was simply not done. Before FastTrack, 1,571 pregnant women were reached within 1 year. But within these 3 months, we were able to provide services for these many pregnant mothers at the health post outreach program and working permanently here at the health center.
The big difference is that no one ever focused like this on the task. But after FastTrack, everyone is highly focused. Both teams were highly focused. We were told to be very focused for 3 months, and because we have done that, we were able to achieve results which exceeds our goal. The community was cooperative throughout the program.
Even though we have never done it at the urban areas, we have arranged a meeting and taught many people in the rural areas to get tested.
Before, no one ever told me that I should get tested. But now Antigain came to me and asked if I was pregnant, and I said yes. And he said, "Are you willing to get tested for HIV at the health center?" And I said, "Why not? Because by taking the test, I can make sure I'm free from HIV, or Allah forbid I have the virus in me. I can make sure that my child will be free from it." And then I took the test.
We are very thankful for this. There has been no one who came to our homes to ask to provide health care for our own benefit.
Just giving a direction to people on what to do is not convincing enough. But this thing they do by going house to house is very effective.
I've been tested for HIV many times in the past, and I get tested every 3 months. I do this in order to be an example for the community and stay healthy at the same time. Some criticize me and say things like, "You are 74 years old. What are you afraid of, death?" Personally, I don't know what else there is to be afraid of than death.
When I meet any pregnant woman, be it a relative or friend, I always tell her to go to the health center and get tested for HIV. Allah forbid she tests positive, she can give birth to a healthy child by enrolling in the service provided by the health center.
PMT FastTrack sira.
The work done in PMTCT FastTrack not only motivated the community, but also was a chance for leaders and the heroes to emerge. The society understood that it's possible to prevent children from being infected by HIV. Pregnant women are highly motivated to take advantage of the service. Many promised to widely participate in convincing other pregnant women. In general, a positive attitude has been created in Merawi, and this positive spirit can be used for other health activities as well.
3 months is not a short time. We are able to adapt good working methods within the period. If scaled up, I believe FastTrack can change the low coverage of PMTCT at the Warada level. And of course, as a result, the whole country's low access to PMTCT situation will be improved. Because the PMTCT service is very crucial in the fight against HIV, I believe scaling up FastTrack will be a good solution.
Scale up beyond lahagar
The task force members who are engaged in every activity in the FastTrack are members of the community in this area. The health extension workers, the volunteer community health workers, the extension worker supervisor, and all the technical professionals working in the quality team are all based here. So that means the system is not dependent on external coordinators. There were mentors and facilitators who showed us the system because it's a new system, but in order to sustain it, support from the external coordinator is not mandatory. So it is possible to continue on implementing this system using the health professionals here at the health center and the volunteers in the community.
FastTrack has been very useful. I wonder if there is anything more valuable than saving human lives. FastTrack is still a useful system. It's like a ladder, a stepping stone. Now we know how the system works. We don't feel like we need to be guided anymore. I personally feel that this is the act of rescuing the life of the new generation and of our own relatives. So there is nothing holding me back. I'll keep on moving forward.
If I take myself as an example, I've been teaching people for 3 months now, but there is no reason for me to stop doing that in the future. I should keep on teaching the community like I used to do in the FastTrack period. Let it be on a church gathering or a community meeting. I am now engaged in other health extension program activities, which gives me the chance to go door to door, and whenever I find a pregnant woman, I still have the responsibility to make sure they get tested. And for those who are not capable of traveling to the health posts, I should take the responsibility and arrange means to get them tested by the health professionals. I don't see any reason to stop working.
Clinton Foundation proved to us that we can achieve great results by working. In our case, results are saved lives. We hope Clinton Foundation keeps up the good work and introduces the system in other worlds, so that within a few years impressive changes can happen. For us, this is a system that we can work with anytime, with or without Clinton Foundation's presence.
Clinton Foundation Clinton Foundation
This used to be our regular work. Now we're able to do better because the Clinton Foundation gave us training, so we can be capable to conduct HIV counseling and testing here. Now we're not worried if a pregnant woman that we referred might or might not have arrived at the health center. Clinton Foundation gave us the skill to begin a great service. As long as we're here to serve our community, we'll keep working the same way we used to.
As long as it is a great system, useful for the country, that can accelerate achievement, then there should be the government's involvement to guarantee its sustainability. This is also an obligation for all Ethiopians. Even though the program has ended, the system can always be used. Currently, our access and tracking teams are still active, and by keeping up the meetings and discussions, together with performance evaluations, the health center is ready to sustain the program or the system.
Ethiopia,